Dr. Kevin Ende again discussing follicular unit hair transplantation and hairline lowering. Again, we are talking about my upcoming newsletters. This one's coming out February 2013. And this particular patient basically had a follicular unit hair transplant to provide both additional density to the sides of his head as well as a hairline lowering. Now, the hairline lowering again was done with follicular unit hair transplant. And as we know, male pattern baldness continues lifelong. So the question always comes up, well, if you're lowering this gentleman's hairline, what happens when he loses more hair? Isn't he going to look funny? What are you going to do about it? Well, the answer is we have this discussion up front because, yes, hair loss is progressive. There are things that you can do to slow it down. There are pills, there are creams, there are shampoos, lasers, all different things that can be used to maintain hair health. However, this gentleman probably will lose more of his hair, and most of the hair loss will most likely occur in the pattern that it's already occurring. So we expect this gentleman to lose a little bit of hair behind the hairline that I have replanted for him. Will this happen in an exact pattern? No, probably won't, but certainly it'll start thinning out going from the front towards the back. And if there's just a few hairs missing, we're not going to rush into doing another hair transplant. But I tell these patients up front, and I'll tell you as well, that you probably will be my patient lifelong. At some point in the future, whether it's 6 months, a year, 5 years, 10 years down the road, as you lose more hair, you'll just get another follicular unit hair transplant to fill in the areas that you're losing it. And then, of course, the question that comes up, well, what about the donor area? What if I run out of donor hairs and you can't take a strip of hair anymore? Well, again, there's follicular unit extraction. We can take individual hairs from the back of the head. You don't necessarily need to have an entire strip removed. Well, then the question comes up, well, what if you've completely exhausted my donor area from doing the strip method and the follicular unit extraction? What else can you do? And as most of you know from reading through my website, you can also do body hair. Body hair doesn't work as well as scalp hair, but it certainly does work, and it's an option to use if you've run out of donor hair. But this gentleman certainly is nowhere near that point. 5 to 10 years from now, if he needs another follicular unit hair transplant to fill in some gaps behind the hairline that I've already replanted, he can certainly do that without a problem.